Our next guest is Dr. Jonathan Lamphier, a new gastroenterologist with Novant Health. Welcome to the show today, Dr. Lamphier.
Thank you. Nice
Pleasure
to
to meet you.
Thank you for asking me to come over.
Now, I understand that you just recently moved to the area. Is that correct?
That's right.
And where is it that you moved from?
I moved from New Hampshire.
Wow. Is it cold in New Hampshire?
It's 10 degrees today in New Hampshire.
So I'm glad I'm here.
I'm glad I'm here, too.
It's kind of cold here, but not that cold. Well, I'm curious, what brought you to this area?
Well, several factors. The weather is a primary factor. Sure. We spend 6 months essentially indoors up in New Hampshire. Last year was a very cold winter, and we've been thinking about this for the last few years, and after the record cold we had last year, we decided this was the year to move south. So here I am.
So here you are. Well, I think you'll find it's a great place to live. The people here are fabulous, and just the lifestyle is awesome. We love it. So let's start by learning a little bit about you, where you went to school, your education, your background, things like that.
I graduated from Boston University, got my MD degree there, and after that we went to Tampa, to the University of South Florida, where I did my internal medicine residency. And I did my gastroenterology fellowship at Emory University, and after that I stayed on for a couple of years and taught.
Wow. Wow. Great background, great education.
Oh, thank you.
Good schools.
Well, I was fortunate.
Yeah, that's awesome. Well, let's talk about the new practice. Now, I understand that it is a brand new practice for Novant. We're just we've just opened up your practice at the beginning of the year. So what is it called?
It's called Novant Gastroenterology.
Novant Health Gastroenterology.
That's correct.
Okay. And where is the practice located?
It's right next to the old hospital, right on 17. It's Doctor's Circle, 6 Doctor's Circle, Suite 5 in Supply.
So that's really convenient there. And there's lots of parking, so I think that patients will find that a great office.
Most people know where that is.
Just about everybody. Well, Supply's not very big, so it's not too hard to find. But that is a very accommodating office. Well, tell me, do you have any specialties or interests that you have in gastroenterology? Is there something you prefer to do?
Well, I'm a general gastroenterologist, which means that I treat basically all GI conditions. My primary focus is on colorectal cancer screening. And screening for complications of reflux disease, such as Barrett's esophagus and esophageal cancer.
Tell me, some folks may not know what a gastroenterologist is. Can you sort of explain that?
Well, we're specialists who treat diseases of the gastrointestinal tract, which is the esophagus, the stomach, the large and small intestine, and the ancillary organs such as the liver or pancreas. And you talked about disorders. Could you elaborate a little bit more on the disorders that you see and that you treat in your office? Well, colon cancer continues to be a big problem.
Really?
And it consistently ranks among the most common cancers, right up with breast and lung cancer.
Really?
The prognosis with an early diagnosis is very good. It's a common disease. The average person who has no family or personal risk factors for colon cancer still has a 1 in 20 chance of having colon cancer. So if you went to downtown Wilmington and took 20 people, put them in a room, one of them over their lifetime would have colon cancer.
Really?
So it's imperative that people have a colonoscopy and identify if they're at risk for colon cancer, colon polyps. Polyps are precursor lesions many times to colon cancer. And by identifying and removing the polyp, which can be done at the same time during a colonoscopy, we can prevent that colon cancer. And since colonoscopy has been the gold standard in colorectal cancer screening, colon cancer frequencies and death rates have actually decreased.
Really?
Yes.
That's awesome. Well, how often should a patient have a colonoscopy?
Well, for somebody at average risk, we generally start at 50 years old. And if that patient doesn't have any polyps, then, and the risk factors remain the same,
Okay.
meaning that no close relative in the family, a parent, sibling, or child has colon cancer or precancerous colon polyps, then that person is considered average risk. And waiting another 10 years for another colonoscopy would be the recommendation. Now, if someone does have polyps or does have a family history of colon cancer, then the intervals are shorter than that. And it really depends on the specific risk factors as far as how often we do colonoscopy for those patients that are at higher risk.
So that's a conversation you would have with your patient and determining how often. And it could be different for several people. I mean,
Yes, actually it is.
It might be a year or 3 years or 5 or 10.
That's correct.
Well, that's really good to know. I know colonoscopy is not something that people enjoy having, I guess.
Well, most people are not aware that they're having it.
They don't even know they had
That's
them.
right, because they're sedated.
That's a good thing.
Yes, it is.
So you believe in sedation?
Well, the sedation is an important part. We do
Yes.
have people, actually, who
No,
request no sedation.
No,
They do.
I can't hardly believe
They
that.
do. And there are patients that, for whatever reason, decide that they don't want to be sedated, and there are a variety of reasons. But colonoscopy does produce some gaseous distension because we put air into the colon.
Yes.
So most people have a little bit of cramping, but people who request no sedation generally do well. Now, that's the minority of patients. Most people
bet.
prefer sedation, right?
It's not funny, but it is funny. So what happens if a patient has a colonoscopy and a problem is found? Now, I know you said that if there's a polyp, you can remove it at that time. But if there's more involvement, then might they be scheduled for surgery, or how does that work?
Well, most polyps can be removed endoscopically. There are some polyps based on the size and location and other risk factors that would put the patient at a higher risk for a perforation. And that's not something that we would essentially put patients at risk for, knowing that it's a difficult polyp. In that particular case, and this is a minority of cases, that polyp should be removed by another method. And the most common method would be surgical.
And those surgeries would be performed at Novant Health, Brunswick Medical Center?
Yes, where we have a staff of general gastroenterologists who are very good.
Yes, I know they've recently added a second suite, opened up the second suite. I know they had one, and now they've opened up the second one. So
that's correct.
Great facility there. I believe you do upper endoscopies also?
Yes.
Can you talk to me a little bit about what that entails?
Well, the principle is the same as a colonoscopy. You essentially have a tube with a light and a camera, patient sedated, and this is a rather quick test. It takes about 5 or 10 minutes for an upper endoscopy, and for most colonoscopies, about 15 or 20 minutes. The upper endoscopy looks at the lining of the esophagus, the stomach, and the upper part of the small intestine. And the most common reason to do that is patients who have reflux disease, who've had many years of heartburn, who are at risk for complications such as precancerous lesions, strictures or narrowing of the esophagus. There are some people that develop difficulty swallowing because of narrowing of the esophagus, and that can be treated endoscopically with balloon dilation.
Great. Well, that's great information. I know that we're certainly happy to have a new gastroenterologist in town, and I think that you'll do very well. Again, you said you're located at 6 Doctor Circle.
That's correct.
In Supply, and we'll put the phone number on the bottom of the screen so patients can give you a call. Now, you are accepting new patients,
We are accepting
correct?
new patients, that's
and
correct.
we pretty much take every insurance, correct?
Yes.
So we'll just put that number on the bottom and they can call your office for an appointment.
Very good.
Well, thank you so much for being here. It was a pleasure to meet you.
Thank you for having me.
And I look forward to seeing you again. We can talk about something maybe more fun.
More fun than a colonoscopy? I don't think so.
You're so funny.